Are you getting up 2, 3, or even 4 times each night just to pee? If that's happening, you're not only losing sleep, you're also losing your daytime energy, concentration, and confidence. There's a truth hardly anyone explains. Those nightly bathroom trips aren't simply an unavoidable part of aging. It's your prostate trying to send a message. I'm Dr. HANA Kim, a men's sexual health specialist, and today I want to have a straightforward discussion that every man past 50 and frankly 40 as well should hear. We're not going to talk about popping more pills, risking side effects, or dealing with uncomfortable procedures. This is about 3 easy everyday habits that can significantly support prostate function, bring back your confidence, and help you reclaim peaceful nights naturally. Everything I'm about to share is supported by science, not hype. The third habit especially might catch you off guard. Stick with me until the end, because these simple insights may influence how you enjoy the rest of your years. Let's begin with the basics. What's truly going on inside your body? The prostate is a tiny gland, roughly the size of a walnut, sitting just beneath the bladder. Its role is to create part of the fluid found in semen. Here's the crucial detail. The urethra, the tube that releases urine, passes right through the middle of it. As the years go by, natural hormonal shifts occur, mainly a change in the balance between testosterone and a version known as DHT. This causes the prostate to gradually increase in size. Picture holding a garden hose while water is flowing and squeezing it tighter. That's exactly what happens when the prostate swells. It presses against the urethra, making it tougher for urine to pass freely. It's very common. By the time men reach 60, over half already deal with these symptoms. Past 70, it's closer to 70%. So many men are facing the same daily annoyance. Difficulty getting urine started, a weak or stop-and-go flow, constantly feeling like your bladder isn't empty, and of course, those repeated nighttime wake-ups. It wears you down. It disrupts your sleep, affects your mood, and yes, it interferes with confidence in the bedroom. Here's the encouraging part. This isn't an inevitable curse of aging. New studies reveal that the right daily choices can slow that enlargement and, in many cases, ease the effects dramatically. So let's talk solutions. Habit number 1. Smart hydration. The timing matters. People always say to drink more water, yet almost no one explains when you should drink it. That's where many men unknowingly make things worse. Too little water causes your urine to become more concentrated. That concentration irritates your bladder and prostate, leading to inflammation. Yet drinking plenty of fluids right before bedtime overwhelms the bladder during sleep hours. That's practically guaranteeing more trips to the bathroom and restless nights. Here's the better strategy. Drink most of your water earlier in the day, especially in the morning and early afternoon. After 6 p.m., decrease how much you drink. Just small sips if you're thirsty. This one tweak keeps your body hydrated while giving your bladder and prostate a break when you're trying to rest. And yes, there's actual research supporting this approach. Research shows that men who follow this style of hydration routine can experience up to a 40% reduction in nighttime bathroom visits. Consider what that means. Better sleep without interruptions and no more lying awake at 3 in the morning wishing you could drift off again. It is one of the easiest and most powerful changes available to you. No medication needed. Habit number 2. The strategic walk. Small effort with a surprisingly large payoff. It may sound too simple to have real impact, yet stay with me. A gentle 10 to 15-minute walk right after your biggest meals can transform your prostate health. Here's why. Blood sugar always spikes after eating. When those spikes happen repeatedly, inflammation quietly builds throughout your system, including inside the prostate. If you take a short stroll after eating, your muscles immediately burn that sugar for fuel rather than leaving it floating in your bloodstream causing trouble. A major study in diabetes care, one of the most respected journals available, showed that 3 15-minute post-meal walks controlled blood sugar even better than exercising for a continuous 45 minutes at another time. That is a game changer. Here's how it relates directly to your prostate. Ongoing inflammation is one of the leading forces behind prostate enlargement and urinary problems. So each time you step out for that light walk, you are not just helping digestion or burning a few calories. You are lowering inflammation. You are defending your prostate. You are improving overall metabolic strength. There is no need for hard workouts. A calm, comfortable loop around your neighborhood after lunch or dinner does the job. 10 minutes a couple times a day. That tiny effort protects a gland that influences your sleep, mobility, and confidence. Habit number 3. The cleansing mechanism. Yes, this truly matters. This is the topic most men stay quiet about. As your doctor, and as someone who has personally reviewed the research, I must address it. I call this natural prostate cleansing. The science behind it is very clear. Harvard researchers followed more than 30,000 men for almost 2 decades. They discovered that men who released more frequently, around 21 times a month or more, had up to a 33% lower risk of prostate cancer than men who did not. 21 might sound like a large number, although the real message is consistency. Staying regular, why does it help? Each release removes old fluid, dead cells, and possible toxins from the prostate. It acts like a refresh cycle for the gland. Without it, those fluids can linger, which increases the chance of inflammation and buildup over time. Here is the key part. The benefit remained the same whether the release happened with a partner or alone. From a medical point of view, this is healthy, natural, and strongly supported by research. There is absolutely no shame in something that keeps both your prostate and emotions balanced. Feeling hesitant about the subject is completely normal. Many men grew up believing this was something never to be discussed. Yet this has nothing to do with judgment or morality. This is biology. It is your health. It deserves honest attention. Tell me when you're ready with the next portion, and I'll keep going in the same style. When these habits work together, they create a powerful team. Each one has benefits on its own, but when combined, you form a complete approach to supporting prostate health. The first habit keeps your prostate hydrated without pushing it too hard. The second reduces inflammation while promoting better blood flow. The third supports cellular function and helps your body clear out internal waste. Altogether, they target the 3 major contributors to prostate problems: dehydration and toxin accumulation, long-lasting inflammation, and cellular slowdown. Maintain these habits, and gradual improvements will begin showing up. Deeper sleep, a stronger urine flow, less discomfort and urgency, a more relaxed bladder. I want to emphasize something important. These habits offer tremendous support, yet they never take the place of routine checkups. If you're past 60, schedule your yearly PSA test and digital exam. Early detection is still the most effective protection you have against serious prostate complications. Your physician isn't judging you. Their purpose is to keep you safe. Feeling awkward about these issues is normal, though every man eventually deals with them. The only difference is who steps up early and who pretends everything is fine until the situation gets worse. Why is this so significant? A healthy prostate helps you feel younger, truly. You rest better. You move with ease. Confidence comes back. No more planning your errands around restroom stops. No more waking throughout the night wondering what's happening to your body. Your energy rises. Focus sharpens. Even relationships improve because comfort and confidence shape how you show up. This has nothing to do with vanity. It has everything to do with freedom. After more than 20 years working with men, I can tell you with complete certainty, taking care of your prostate doesn't just add years to your life, it adds life to those years. Let's summarize. 3 habits. Smarter hydration. Drink most of your water earlier in the day. Keep your prostate cool and relaxed while you're awake, and allow it to recover overnight. Movement with purpose. A brief 10-15-minute walk after meals helps control blood sugar, reduce inflammation, and improve circulation. Natural cleansing. Stay regular. Keep things moving so tension and waste don't build up. These habits are simple, cost nothing, and depend entirely on your own consistency. No prescription required, just a decision to take charge. As your men's sexual health specialist, I assure you your body will reward the effort. If this helped you, I ask one thing. Share it. Tell a friend, a brother, a father, or a son. Men's health begins with honest conversation. The more openly we speak about it, the more we normalize it, without shame or fear. Only truth. Strength isn't pretending everything is fine. Strength is acting now, before problems become urgent. This is Dr. Hana Kim reminding you. Your health isn't a burden. It is your power. You deserve to feel strong, confident, and fully alive every single day.